Welcome, everyone, to our live ophthalmology trivia show. Get ready to flex those optic nerves and test your knowledge on everything from corneal disorders to neuro-ophthalmology. Whether you're a seasoned specialist or an eager student, tonight's challenge is sure to keep your eyes wide open. We'll dive into 25 questions, each with 4 answer choices. Only one is correct. The faster you answer, the more points you earn. To submit your answer, simply comment the number of the correct option or type the full answer. Expect questions on cataract surgery, retinal conditions, pediatric strabismus, and more. It's a comprehensive eye exam for your brain. Remember, 25 questions, 4 options, 1 correct answer, speed counts. Let's begin. Question 1 of 25 coming your way. Let's get started. In the differential diagnosis of ectatic disorders, Rizzuto's sign is 1. Seen predominantly in keratoconus due to cone-induced light focusing. 2. Seen in both keratoconus and keratoglobus. 3. Seen exclusively in pellucid marginal degeneration. 4. Absent in keratoconus but present in PMD. Comment the number or type the full answer. Take your time, but not too much. Speed boosts your score. Rizzuto's sign creates a conical light reflex on the nasal cornea. Fascinating, right? 43 nailed it. Great job, everyone. Mohammed, Radwa, Iman, Black Panther, impressive. Here comes question 2. Get ready, eye experts. In band-shaped keratopathy, the typical Swiss cheese appearance is due to 1. Lipid infiltration. 2. Interruption of calcium deposition by corneal nerves. 3. Ghost vessels in cornea. 4. Accumulation of mucopolysaccharides. Lock in your answers now. Calcium patterns can reveal fascinating corneal pathology. Keep those answers coming. Band-shaped keratopathy often appears in chronic uveitis or hypercalcemia. Clinical clues matter. "51 got it right. Nice work. Mohammed, safe. Mahmood, Mr. Native, brilliant. Here comes question 3. Focus those clinical minds. Regarding management of these branching needle-like stromal opacities with minimal inflammation, which is correct? 1. Topical broad-spectrum antibiotics plus or minus fortified drops are first line. 2. Therapeutic penetrating keratoplasty is never required. 3. Systemic antibiotics alone are usually sufficient. 4. Corticosteroids are the mainstay of therapy. Make your best choice now. These opacities often hint at infectious keratitis. Choose wisely, future specialists. Infectious crystalline keratopathy often follows surgery or steroid use. Watch closely post-op. Only 5 got it. Tough question. Muhammad, Mustafa, Anas, safe. Well done. Crab claw pattern appears in other conditions. It's not keratoconus specific alone. Only 11 got it. Precision matters. Omar, Mohammed, Wad, great job. Question 5 coming in, let's test your diagnostic instincts. A patient with progressive symblepharon, ankyloblepharon, and fornical shortening without drug allergy history most likely has 1. Stevens-Johnson syndrome. 2. Severe trachoma. 3. Ocular cicatricial pemphigoid. 4. Atopic keratoconjunctivitis. Choose carefully, chronic conditions often hide behind subtle clinical clues. Symblepharon often results from chronic inflammation or autoimmune conjunctival diseases. "44 nailed it, great clinical insight." Nada, Fatma, Iman, Muhammad, well done. Question 6. Let's focus those lenses and sharpen your thinking. Which of the following is a known limitation or complication of femtosecond laser-assisted cataract surgery? 1. Unpredictable IOL power. 2. Increased risk of endophthalmitis. 3. Higher rate of retinal detachment. 4. Capsular tags or incomplete capsulotomy. Precision tech isn't always perfect. Choose your answer now. Femtosecond lasers improve precision but may cause capsulotomy-related complications. "55 answered right, great surgical knowledge." Wad, Nada, Muhammad, excellent work. Question 7, let's dive into surgical strategy mode. Which intraoperative strategy is least effective in preventing complications of intraoperative floppy iris syndrome? 1. Use of viscomydriasis with cohesive OVDs. 2. Use of iris hooks or pupil expansion devices. 3. Use of intracameral phenylephrine/epinephrine. 4. Preoperative discontinuation of tamsulosin. Think like a surgeon, precision matters. Lock in your answers now. Tamsulosin relaxes prostate muscles but affects iris behavior during surgery. "22 nailed it, tough question indeed." Miriam, Muhammad, Radwa, native, great job. Let's move to question 8, UGH syndrome, not as fun as it sounds. The definitive management of UGH syndrome is 1. Systemic immunosuppression. 2. NDYAG laser peripheral iridotomy. 3. Long-term topical steroids and anti-glaucoma drops. 4. IOL repositioning or exchange. Think carefully, UGH isn't just a feeling. Lock in your answers now. UGH syndrome stands for uveitis glaucoma hyphema, often linked to intraocular lens complications. "44 got it right, impressive work." Saif, Mustafa, Mohammed, Iman, well done. Question 9 coming up. Let's test your ocular oncology knowledge. Nevus avuta is most commonly associated with increased risk of which intraocular malignancy? 1. Uveal melanoma. 2. Medulloepithelioma. 3. Conjunctival papilloma. 4. Choroidal hemangioma. Think fast. Pigmentation might mean more than meets the eye. Nevus avuta involves increased pigmentation around eye and trigeminal nerve. Rare, but significant. "62 nailed it, stellar accuracy, everyone." Gahad, Wad, Safe, Nada, great job. Question 10, let's dive into the world of white dot syndromes. Which of the following white dot syndromes most often presents unilaterally at onset? 1. Multiple evanescent white dot syndrome, MEWDS. 2. Multifocal choroiditis with panuveitis, MCP. 3. Birdshot chorioretinopathy. 4. Acute posterior multifocal placoid pigment epitheliopathy, APMPPE. Eyes on the prize, choose wisely, ophthalmology fans. MUDS often affects young women and usually resolves without lasting vision damage. "55 answered correctly, great job, everyone." Gahad, Saif, Mohammed, Mahmood, well done. Question 11, let's test your uveitis knowledge, folks. The most common ocular manifestation of Behçet disease is 1. Panuveitis with occlusive retinal vasculitis. 2. Non-granulomatous anterior uveitis with hypopyon. 3. Intermediate uveitis. 4. Anterior uveitis with granulomatous KPs. Eyes wide open, pick your best answer now. Behçet disease often presents in young adults, especially along the Silk Road region. "29 got it right, great job." Gahad, Nada, Mustafa, Fatma, well played. Question 12. Let's keep those brains sharp and eyes sharper. This condition is most commonly 1. Unilateral and usually asymptomatic. 2. Bilateral and symptomatic with severe visual loss. 3. Bilateral and associated with systemic disease. 4. Always associated with diabetic retinopathy. Trust your instincts, lock in your answers now. Uveitis can affect one or both eyes, depending on the underlying cause. "48 answered correctly. Fantastic work, everyone." Gahad, Wad, Fatma, Mohammed, well done. Question 13. Let's test your retinal detective skills. A 39-year-old gentleman has a shallow rhegmatogenous retinal detachment in his left eye. It extends from 4 to 8 o'clock. Where is the likeliest site of the primary break? 1. None of the above. 2. Above the horizontal meridian. 3. 6 o'clock. 4. 12 o'clock. Think anatomically. Time to lock in your answers now. Retinal detachments often start at a retinal tear or hole. Stay sharp. "42 nailed it. Great job, everyone." Gahad, Nada, Hamada, Mohammed, excellent work. Question 14. Let's dive into retinal anatomy. The most common site for retinal dialysis is 1. Supraornasal quadrant. 2. Superior temporal quadrant. 3. Inferotemporal quadrant. 4. Inferior nasal quadrant. Think carefully, quadrants matter. Lock in your answers now. Retinal dialysis often occurs after blunt trauma. Watch out for sports injuries. "19 got it right. Well done." Shout out, Mustafa, Saif, Hamada, Huggy Wuggy. Question 15 coming in, eyes on the screen. The smokestack pattern on fluorescein angiography is classically seen in 1. Retinal vein occlusion. 2. Macular hole. 3. Choroidal melanoma. 4. CSCR. Visual clues matter. Lock in your answers now. Fluorescein angiography helps visualize retinal blood flow using fluorescent dye. "58 nailed it. Excellent work, everyone." Iman, Mustafa, Shima, Fatma, great job. Here comes question 16. Think carefully, everyone. A patient with subperiosteal abscess can be managed by observation in the following situations, except 1. Presence of gas in the abscess on CT scan. 2. Patient younger than 9 years. 3. Medial location of subperiosteal abscess. 4. Associated with isolated ethmoidal sinusitis. Time to decide. Trust your clinical instincts now. Subperiosteal abscesses often occur as complications of sinus infections in children. "16 got it right. Tough question today." Mohammed, safe. Huggy Wuggy, Mustafa, well done. Here comes question 17. Focus up, everyone. Which investigation is the gold standard for a patient presenting with pulsatile ptosis, brute over the orbit, chemosis, and corkscrew episcleral vessels? 1. Orbital ultrasound. 2. MRI brain. 3. Digital subtraction angiography, DSA. 4. CT orbit. Eyes wide open, choose your best diagnostic tool now. Corkscrew episcleral vessels suggest abnormal arteriovenous connections behind the eye. "37 nailed it. Great diagnostic instincts." Nada, Ahmed, Mustafa, Huggy Wuggy, excellent work. Question 18. Neurology fans, this one's for you. The lesion site in Wabino is most commonly 1. Bilateral paramedian pontine reticular formation, PPRF. 2. Bilateral oculomotor nerve. 3. Bilateral medial longitudinal fasciculus, MLF. 4. Bilateral abducens nucleus. Think brainstem anatomy, locking your answers now. Wabino stands for Waleed bilateral internuclear ophthalmoplegia, rare but fascinating condition. "33 answered correctly. Great brainstem knowledge." Safe, Ahmed, Zayedi, Michelle, brilliant work. Question 19. Time to test your toxicology smarts. Which of the following is the primary antidote for methanol optic neuropathy poisoning? 1. Naloxone. 2. N-acetylcysteine. 3. Fomepizole. 4. Atropine. Eyes on the prize, submit those answers now, toxin tamers. Methanol poisoning can cause blindness. Prompt treatment is absolutely critical. "17 got it right. Nice work. Zayden, Fadlone, Mahmoud, great job." Question 20. Neurology fans, this one's for you. A 50-year-old man develops sudden diplopia. Right eye, no adduction on left gaze. Left eye, abducts with nystagmus. Nether eye moves to the right side. What is the most likely diagnosis? 1. Wabino. 2. Right 1.5 syndrome. 3. Right internuclear ophthalmoplegia, INO. 4. Left 1.5 syndrome. Eyes on the clues, locking your answers, brainiacs. The medial longitudinal fasciculus coordinates eye movements. Damage causes ophthalmoplegia. "32 nailed it. Great diagnostic skills." Miriam, Iman, Mohammed, Ahmed, well done. Question 21. Let's test your ophthalmology knowledge. All are associated with Hobbs striae except 1. Keratoconus, 2. Corneal enlargement, 3. Congenital glaucoma, 4. Buphthalamus. Think carefully, those corneal clues can be tricky. Hobbs striae are horizontal breaks in Descemet's membrane, seen in congenital glaucoma. "44 got it right. Impressive work." Mustafa, Nada, Fatma, Omar, great job. Question 22. Let's dive into some gonioscopy. In angle recession glaucoma, which gonioscopic finding is most characteristic? 1. S-shaped iris insertion, 2. Posterior synechia with iris bomb, 3. Deep, widened ciliary body band, 4. Anteriorly displaced Schwab's line. Eyes on the angle, choose your answer carefully. Angle recession often follows blunt trauma. Watch for widened ciliary body band. "52 nailed it. Great clinical insight." Mustafa, Radwa, Arwa, Ahmed, well done. Question 23. Let's talk post-op pressure spikes. Following Ahmed valve implantation, a patient initially has low IOP. At 6 weeks post-op, the IOP rises to 30 mm of mercury. This condition is 1. Suprachoroidal hemorrhage, 2. Late valve failure, 3. endophthalmitis, 4. Early hypertensive phase. Think timing, think pressure, locking your answers now. Early hypertensive phase usually peaks around 1 to 2 months after surgery. Only 12 cracked this tricky one. Kudos Mustafa, Radwa, Muhammad, Hoda, impressive. Here comes question 24. Focus on those infant eye movement clues. An infant shows cross-fixation, tight medial rectus muscles, and head turned towards the fixing eye. The most likely diagnosis is 1. Mobius syndrome, 2. Infantile nystagmus syndrome, 3. Science's syndrome, 4. Brown syndrome. Trust your instincts. Submit your answers now, future diagnosticians. Sciencea's syndrome often presents in infants with large-angle esotropia and cross-fixation. "37 nailed it, great diagnostic instincts." Shout out Nada, Mustafa, Ahmed, Mohammed, well done. Final question, let's test your binocular vision knowledge. A patient undergoes the Worth 4-dot test. He wears a red lens over the right eye and a green lens over the left. He saw 2 red dots on the left side and 3 green dots on the right side. What is the most likely diagnosis? 1. Uncrossed diplopia. 2. Suppression of the left eye. 3. Cross diplopia. 4. Alternating suppression. Eyes on the prize, locking your answers now, vision experts. Worth 4-dot test detects suppression and diplopia in binocular vision assessments. Correct answer, cross diplopia, well spotted. 16 players got it absolutely right. Kudos Mohammed, Mahmood, Huggy Wuggy. What a game, 82 players, incredible energy. Mohammed Fadloon takes the crown with 25 correct. Congrats to all top scorers. Thanks for playing, see you next trivia night.